PCOS, polycystic ovary syndrome. A lot of people have that diagnosis or know of people who have been diagnosed as having it. So in today's video, I'll be talking about it. So why is it important to know about PCOS and to manage it? First of all, it's responsible for a lot of anxiety when it comes to irregularities in periods or no periods among the young. It's also associated with infertility, which is where we see a lot of patients with PCOS. Now, for long-term abnormalities, it can be associated with things like endometrial cancer, because with polycystic ovary syndrome, there is excessive growth of the walls of the womb, something called endometrial hyperplasia, and this could progress to cancer if not managed. PCOS patients are also predisposed to having type 2 diabetes, having high cholesterol, high blood pressure, heart disease, stroke in later life. They're also at risk of having things like depression from all of this. So these are the reasons why it's important for us to discuss PCOS and to know more about it. So what are the things that you might notice that might make you suspect that you have PCOS? The first is irregular periods or no periods at all. The second is difficulties in getting pregnant. Also, you could have acne, excessive facial and body hair because of the high levels of androgens or male hormones, increased weight gain, and thinning or loss of hair. So what causes PCOS? Well, we're not very sure about that, but we know that there is a genetic component because it seems to run in some families, but we don't know what gene is associated with PCOS yet. We also know that it has to do with hormonal imbalance because there's something called insulin resistance, which means that your body cells do not react correctly to insulin, leading to excessive production of insulin. And excessive production of insulin would lead to increased levels of male hormones in your body. And this is responsible for a lot of the symptoms that are associated with PCOS. For diagnosis, we usually use 3 criteria. And if you have 2 out of the 3, then we make a diagnosis of PCOS. The first criteria is irregular menstrual periods or no periods at all, which is directly linked to no ovulation or anovulation. The second is signs of excessive male hormones, especially what we call hirsutism, which is just excessive hair growth, especially on the face and around the body, like the chest area and the trunk area in general. And the third is ultrasound scan evidence of multiple cysts in the ovaries, or what we actually call polycystic ovaries. So if you have 2 out of 3 of these criteria, we're able to make a diagnosis of PCOS. Now, knowing this, a lot of people will come to the realization that you actually might not have PCOS. A lot of people have had just scans that showed that they might have polycystic ovaries, but they have no symptoms at all, which means they menstruate regularly, they don't have any signs of excessive male hormones. For those people, we say they have something called polycystic ovary morphology, not PCOS. Treatment, there's actually no specific medication or cure for PCOS. However, we manage you based on your symptoms. So your most bothersome symptom is what we address. So for young people with PCOS who would commonly present because of irregular menstrual periods, acne, and excessive hair growth, we would manage them based on these symptoms. For all patients with PCOS, our first line of management is always optimization of your body weight. So if you're overweight or obese, we would be wanting you to lose some weight. To regularize the periods, we usually use a couple of medications like combined oral contraceptive pills. We also use the progesterone-only pills. And for some people, we could use something like the Mirena coil just to keep the lining of the womb thin. For excessive hair growth, we could use some methods that every other person uses to get rid of excessive hair, like shaving, laser or hair removal, like bleaching. There are also medications that can be used and creams to try and get rid of excessive hair growth. Acne, we could also use some medications for this. For patients with PCOS presenting to the fertility clinic, we would like to manage them first of all by optimizing their weight. And then we use medications to induce ovulation in them. We use Clomid or clomiphene citrate, letrozole, which is actually a medication for treating breast cancer and is not licensed for use for ovulation induction in the UK, but it's a medication we use because we know that it works for ovulation. And also medication like metformin to help with the insulin resistance we've talked about previously. Now, if these do not work, or combination of these do not work, we go on to surgical management, which is something called laparoscopic ovarian drilling. This just means a keyhole surgery where we use laser to make some holes on the ovary. And this actually reduces the amount of the male hormone circulating in the system and helps with the symptoms associated with the PCOS, including fertility issues. So if you suspect that you might have polycystic ovary syndrome, I would advise that you see your doctor about this and possibly get referred to a specialist so that you can start managing your condition. If you've enjoyed this video, please like, drop a comment, and follow for more tips.